really important role, and I'm glad to see there are some nurses here, is I think nurses are such important barriers of defense against error, especially when you have a junior resident, you just got your degree and now you go out into the emergency room and you think you're God. And the nurse who's been there for 10 years or 15 years knows far more about how to deliver the baby safely than perhaps you ever will. And yet in India we don't have this respect for culture. Respecting, the culture of respecting a nurse, that she is a clinician, she knows what's going on, is really not there. And especially in the pediatric department, where the nurses can sense, because they're with the baby all the time, that something's not going well. What do you do about that?
I think every time I enter the ward, I first meet the ward sister. Even much before I meet the resident. Because I know she knows probably much something finer than what my resident has. In an ICU, in an NICU, my sister who is experienced knows so much more than even a fellow in neonatology. And I think I look back at my resident days, I have even learned from a ward boy how to hold a patient for doing a lumbar puncture. He told me, just bend a little and you will get the fluid. I recall having learned even from an experienced ward boy who was helping me to hold the patient, and he thought that patient was not in right position. He taught me how to hold. Imagine the experience of a maybe uneducated person who could teach a person who had qualified. And I feel the nurses are most important, especially in a neonatal ICU. A nurse can pick up, sir, I don't like this baby not doing well. And my resident said, heart rate is all right, respiration is all right. No, that baby is not all right. The next thing to the nurse is, of course, the mother of my patient. And I have learned over years, we teach the student, mother knows more than a pediatrician. If mother says, I don't like the way my child is behaving, you take it for certain you're missing something. And if you don't know, find out what you're missing. But don't be brave and say, no, everything is all right. You will be proved wrong. It will be a slap on your face. I think as a doctor, I would listen to a mother, I would listen to a nurse, knowing that they may know a little more than what is happening with the child. I may know science, but they know exactly what is happening.
I can't anything more. I remember when we started the ICUs, some of the first ICUs that we started, the sister was the single most important person in the ICU. And believe you me, she would know more about the patient than a postgraduate student who was qualified, who was fairly experienced. And I would always first ask her, what do you think? And I would ask her, what do you think we should do outside the patient? So what do you think we should do? Do you think we should start this now, or should we wait for something? And talking about the individual who helped you to a lumbar puncture, I remember my first day as a resident house physician at the KEM hospital in Ward 12, when I was deluged with 40 patients coming as an emergency. And there was one huge man who was getting continuous seizures. And the registrar writes from the room, do a lumbar puncture. He said, lumbar puncture on this patient, how do I do? So there was this poor cleaner, who used to look after everybody's dirt, etc. His name was Bhagwana. And he said, chalo saab main batata hu aapko kaisa lumbar puncture karna. Jarur Bhagwana batao kaisa karna. So he said, chalo aao, idhar aao, Gafur idhar aao, wo udhar aao. And they managed to hold him down. And I muttered a prayer in my Zoroastrian language, pushed the needle in, and I beamed when the water came out. I will never forget it, I never forget. And you won't believe it, I don't know, I suppose it was a stupid thing to do. I once invited him to the mess to have lunch with me, and the others were absolutely shocked, absolutely shocked. There was Bhagwana and there was Gafur. Gafur was the head ward boy and Bhagwana was the, I don't know if you remember him or he was there in your time. But I think the nurse is the sister is extremely important. And one of the sisters that I had who started the ICU and was with us for a long time was absolutely an invaluable asset to the unit.
I think what Dr. Udwadia is emphasizing is the need for respect. It's not just respecting your patient, it's not just respecting your patient's relatives, it's not just respecting your juniors, it's also respecting everyone who's a support staff member within a hospital, because a hospital doesn't work just based on a doctor. We tend to think that, you know, if there weren't any doctors, the hospital would close down. But the reality is that the support staff, and because they're there all the time, and if we're smart enough and are willing to learn from them, we'll be able to do a much better job, because they can pick up a lot of this stuff, even though they don't have a formal degree. Yes, Doctor.
I think our error is that we equate illiteracy with lack of intelligence. We do this with patients, we do this with patients' relatives, and we sort of continue to do this with people whom we consider infra-dig. The ayah who looks after a female patient, or the boy who looks after a male patient. We believe that because they can't speak English the way we do, and because they're not as educated as we are, their opinions are not worth considering, which is, I think, the height of stupidity.
Dr. Pandya, you started the issues in medical ethics. It's now the Indian Journal of Medical Ethics.